the whole process that patients experience, where the dismissal from clinicians of either telling them it's just in their head or telling them it's normal or telling them there's nothing more they can do, it really, really messes with the psyche of a patient. Just saying that it's all in their head and there's really nothing wrong. This section here recognizes the impact on the patient, but it also puts the burden on the clinician to be adequately trained and have adequate knowledge about endometriosis to bring it up in the discussion and know how to proceed with the evaluation and potential treatment options. It also puts a heavy burden on the training programs. There has to be adequate training in residency to let those doctors either have the ability to diagnose and to potentially treat the disease or know their limitations and be willing to refer on to a higher degree of specialized care.
Hey, lovely Jeff. Thank you so much. Well said, and you're absolutely right. So dismissal of an endo patient can really mess up with the psyche of a patient, which might lead to trauma. And I already spoke about this in the past, e.g. on social media and also on my webpage, and it's really an important topic. Furthermore, Jeff, as you know, I have also posted a comparison of the German and American endometriosis guidelines in the past on social media, and I guess it was in spring this year, 2026. And for the ones who don't know it yet, but who want to watch it, I give you the links to it in my caption, so there's a part 1 and a part 2 of the comparison of these two guidelines. And generally, we see a shift to diagnosing endometriosis by imaging, so in a lot of endometriosis guidelines worldwide, but this can really put some endo patients at risk because imaging might miss endometriosis completely, and moreover, one cannot always distinguish endometriosis from cancer on imaging. And the European Endometriosis Guideline by ESHRE 2022 has actually the same problem, because since 2022 it's also allowed to diagnose endometriosis by imaging according to this European Endometriosis Guideline. And Dr. David Redwine said about this that someone opened up a can of worms. And he was absolutely right. And Dr. David Redwine finished one of his last endometriosis posts on Facebook with the words, "I hope the future is better for everyone." And that's what I also hope. So, see ya and take care, bye bye.